And in last class we have come to a point that we were very much clear that the part which is responsible for thermoregulation in the body is mainly the hypothalamus. In today's class we'll deal with the set point. What is set point, how the set point is maintained, okay, and what are the applied aspects for this thermoregulation. Okay. So regulation of body temperature, it is 98.6, and when we are talking in centigrade, it is the set point is 37, but the range is from 37. Okay, so that is the range in which the temperature of the core or the core body temperature has to be maintained. Okay. Now, when we are talking of this core temperature, what are the factors which can affect the change in core body temperature? Now, these factors can be physiological as well as it can be pathological. When we are talking of physiological, what are the factors which will change the core temperature? First is the circadian rhythm, diurnal variation. Okay. So, in early morning when we are taking the temperature at 6 a.m., it will be slightly less. Okay. Minimum core temperature when we are talking physiologically. Maximum core temperature at what time? 4 p.m. So, that is the diurnal variation. Perb क्या हुआ? Something important to discuss? What do you mean by the thermoneutral zone? In case of adults, it is, okay, this is the refers to the range of ambient temperature within which the metabolic rate is at minimum. In this zone, the body has to spend no energy beyond the basal metabolic rate. This is thermoneutral zone. This varies in adults, newborns and premature. Why it is different in newborns? Because of the presence of brown fat. So, how the mechanism of brown fat works? क्या mechanism है brown fat metabolism का? Mitochondria. And what is the important function which is performed by this brown fat mitochondria? माइटोकॉन्ड्रिया है, ठीक है. तो माइटोकॉन्ड्रिया ऐसा क्या स्पेशल रोल कर रहा है उसके अंदर? It is uncoupling protein formation. Okay, that is responsible for thermogenesis in brown fat, and this brown fat is mainly present in babies. Okay, this is the mechanism. अनकपलिंग प्रोटीन, ओके, मैकेनिज्म. जब आप उसको देखोगे तो उसमें सर्च करोगे कि जब एटीपी फॉर्मेशन हो रहा है और हाइड्रोजन आयन भी फॉर्मेशन हो रहा है, पर उसके अंदर एक पर्टिकुलर मैकेनिज्म है, दैट इज अनकपलिंग प्रोटीन मैकेनिज्म विच इज सीन इन ब्राउन फैट. ओके, दैट इज रिस्पॉन्सिबल फॉर thermogenesis in newborns. Critical temperature, it is the lower limit of the thermoneutral zone. Preferred ambient temperature. So these are the terms. Now, thermo control system. What are the main components of thermo control system? इसके अंदर दो important receptors work कर रहे हैं. First is the peripheral receptor, peripheral thermoreceptor, and second is the central thermoreceptor. What are the peripheral thermoreceptors? These are present on the surface of the skin. Okay, they are acting at peripheral level, so they are peripheral thermoreceptors. Another is the receptors which are located in the hypothalamus. They are known as centrally placed thermoreceptors. Clear? Next important component is the hypothalamus. उसके अलावा क्या है? Effector mechanism. What are the different ways the effector mechanism works? ये लास्ट क्लास में बात की है अपन ने, कुछ नया नहीं है. We have talked about autonomic nervous system. We have talked about the somatic nervous system. We have talked about the endocrinal mechanism. And lastly, we have talked about the behavioral mechanism. So these are the effector mechanism. कौन कौन से हो गए? ऑटोनॉमिक नर्वस सिस्टम हो गया, सोमैटिक हो गया, एंडोक्राइनल हो गया और बिहेवियरल हो गया. हाउ विल द सोमैटिक नर्वस सिस्टम वर्क? What are the different sweat glands present in the body? What are the different types of sweat glands present? The sweat is lost by the body in three special ways. First is the insensible perspiration. Second is the cold sweat. And third is the thermal sweat. What is the difference between cold sweat and thermal sweat? In case of cold sweat, it is seen when there is emotional stress. It is seen in the areas of palm. Generally, palms, they do not sweat, but in emotional condition, there is sweating mechanism taking place at the palm region. इसको हम बोलते हैं cold sweat. They are innervated by sympathetic nervous system, by which innervation? Adrenergic. Whereas when we are talking of the thermal sweat mechanism, they are innervated by sympathetic nervous system but cholinergic nerve endings. Clear? So body loses the sweat by three mechanisms. One is the insensible perspiration, second is the cold sweat mechanism, and third is the thermal sweat mechanism. Normal sweat mechanism falls under which category? Thermal sweat mechanism. Clear? So these are the receptors, peripheral, present on the skin, and chemical central thermoreceptors. They are located in the hypothalamus, mainly in the anterior region of the hypothalamus preoptic area. This is hypothalamus. Integrating and many controlling elements of the thermoregulation are located in this. The system works as a control system that uses negative feedback to operate another system. The set point is 98.6 degree Fahrenheit. What do you mean by set point? Ideal conditions. Okay. So ideal condition में अपनी body ने क्या set point कर रखा है? So is it always 37 or is it having a range? Range. So that range is the set point of the hypothalamus. Whenever this range gets disrupted, okay, what are the mechanisms by which these range can be disrupted? Either there is increase in the core body temperature or either there is decrease in the core body temperature. What are the factors which can affect increase or decrease? Whether it is only the metabolic reactions which are responsible for change or it is the environment which is responsible for the change? Both. Okay. So when there is change in the environment, okay, which receptors will get stimulated? The peripheral receptors. Here, whenever there will be change in the metabolic reactions, thermogenesis by liver, thermogenesis by muscles, then which receptors will get stimulated? It is the thermoreceptors which are present in the hypothalamus. So the information is finally going to which part? Hypothalamus. Now hypothalamus, it has two important parts, anterior and posterior. Here, so each part is specific for regulating when there is body heat increase or body heat to be decreased. So accordingly the command will be given and by different mechanism it will be regulated. Okay, sensing neurons or feedback detectors in anterior hypothalamus collect information for peripheral and central receptors. Heat loss center or anti-rise center, preoptic area of anterior hypothalamus. तो ये किसके लिए responsible होगा? Anterior heat loss. Body को heat loss की जरूरत कब पड़ेगी? Whenever there will be increase in the body temperature or the environmental temperature, okay, which is giving information and asking the hypothalamus to dissipate or to lose the body heat. So anterior is responsible for heat loss mechanism. कब activate होगा? When there will be increase in the body temperature. Increase in the body temperature may be core, may be shell. When we are talking of the shell body temperature, it is the peripheral receptors which are responsible for giving information. When we are talking of the core, it is the intermetabolism which is responsible for increasing the temperature and stimulating the central receptors which are present in the hypothalamus. So anterior hypothalamus किसके लिए responsible हो गया? Loss कैसे करेगा? Through different heat loss mechanism. और posterior hypothalamus thermogenesis. It will be responsible for increasing the body temperature. Increase in body temperature की requirement कब होगी? When there is decrease in the environmental temperature or when there is decrease in the internal metabolism, the temperature is falling, so that will be stimulating the receptor to work accordingly and to generate heat. Clear? So these are the two centers present in the hypothalamus. That is why hypothalamus is known as the thermoregulatory center. Okay, this we have seen in previous class also. Exposure to cold. Whenever there is exposure to cold, what will happen? Which center will get activated? Posterior. Posterior stimulate होगा तो वो क्या करेगा? Conserving heat. Conserving heat के लिए first action क्या आता है? Vasoconstriction. Second is piloerection. But piloerection क्या होता है? Animals के case में ज़्यादा efficiently work करता है, not compared to human beings. Okay. Third is mechanism of heat production. Okay. First is shivering and second category is non-shivering. Okay. Under non-shivering is the increase in the muscle tonicity that results and generates heat. So increased activity and other behavioral responses. Increases TSS secretion and increases catecholamine secretion. So endocrinal, somatic, sympathetic, behavioral, all the changes will be required to increase in temperature. और किसकी हेल्प से हो रहा है? Posterior hypothalamus की वजह से. कब हो रहा है? When the temperature is, the ambient or the external environmental temperature is decreased compared to the core body temperature. Exposure to heat, excessive heat. Now heat may be dry heat or humid. So mechanism of promoting heat loss is vasodilation. Second is sweating. अब sweating भी कितनी तरह से हो गया? Heat loss mechanism के अंदर तीन तरह के आ गए. First is perspiration. Perspiration भी insensible perspiration. Sweat mechanism is cold and thermal sweat mechanism. Cold when there is emotional stress, that will result into cold sweat mechanism. Thermal is when there is increase in the dry heat and the sweat formation increases, and along with the formation there is evaporation of the sweat that will result into the cooling of the skin or the core temperature. So it is not only sweat mechanism. Increase in respiration or panting. Panting seen in case of animals, especially in case of dogs. Mechanism decreasing heat production, anorexia, apathy, and decrease in the TSH secretion that will result in exposure to the heat or environmental conditions. So this is about the vasodilation, how much it will be done, what are the centers or which are controlling it. Sweat causing marked loss of body heat and sodium chloride. Insensible perspiration, cold sweat, and thermal sweating mechanism. Three types of water loss from the skin. So along with thermal regulation, your concept regarding the skin has to be clear. What are the different layers of the skin? Dermis, epidermis, okay. What are the glands, sebaceous glands? where acne formation takes place? If there is a no. Why acne is seen in teenage or adolescent? Why not before that? At that particular age, the stimulus something is coming, so that is resulting or increasing the secretion of 10 बजे नींद आ रही है. चलो खड़े हो जाओ, भाग जाएगी नींद. ठीक है, तो ये स्ट्रक्चर ऑफ स्किन भी इसके अंदर आना जरूरी है. Glands responsible for thermal sweating is eccrine. What are the other type of glands? Apocrine. These glands, they are present in the axillary regions. Okay, so they are different. Eccrine glands and exocrine glands. Okay, and this eccrine glands, they are responsible for the sweat formation and sweat evaporation. Acclimatization, when does it take place? When a person is exposed to this environmental conditions, within 7 to 10 days, the acclimatization takes place. Acclimatization और कब पढ़ा है? Respiration में. Activated by cold, cutaneous vasoconstriction, shivering is evoked in response to impulse from heat production and conservation center. Non-shivering के अंदर babies के case में क्या आ जाएगा? Brown sweat, especially. Okay. Increase sympathetic stimulation, increase in release of catecholamines, epinephrine and norepinephrine. This is role of brown fat. It is responsible for 100% increase or thermogenesis in babies. Abnormalities of regulation. Okay. Fever. Another name for fever is pyrexia. Okay. So when we call it fever, and what are the mechanism of fever? Okay, having fever is a good sign or bad sign? कितने जने बोलते हैं कि good sign, having fever is a good sign? पूरा हाथ खड़ा करो, या तो हो या नहीं हो. नहीं? Why you are saying it that it is a good sign? आपस में डिस्कस नहीं करना है, अगर पता है तो बोलो. Now this fever is increase in the normal body temperature range. Okay. In case of fever or pyrexia, it can be simply classified into infectious or non-infectious category. The classification and pathogenesis you will be dealing in detail in next year, okay? Hopefully. फिर अपन इसके केस में आते हैं कि फीवर का पैथोफिजियोलॉजी क्या है या क्या मैकेनिज्म है, किसकी वजह से ये फीवर जनरेट हो रहा है या फॉर्म हो रहा है. So the important mechanism is if there is an infection, okay, or there might be changes in the autoimmune reactions, inflammatory reactions, okay, the two category may result in what sort of formation. So what they will do, they are going to affect the immune system. Clear? What are macrophages made up of? Divyansh, what is the other name for macrophage? Which cell becomes macrophage? Monocytes. Okay, monocytes turns into macrophage. So when there is invasion from the outer source, bacteria, virus, okay, it results into the release of cytokines. What are the different cytokines which are getting released? These are the interleukins. Interleukins, mobile, mobile, interleukins 1, 6, okay, tissue necrotic factors. These are the chemicals which are getting released. What they are going to do? They are responsible for increase in the prostaglandin E synthesis and formation. Where the prostaglandin formation or synthesis takes place? In the hypothalamus. Okay, and this increase in prostaglandin synthesis formation in the hypothalamus will change the set point of the hypothalamus. Initially, physiologically, normally, what was the set point? It was between 36.5 to 37.7. So that was the set point or the range range of the thermostat set. बट क्या मैकेनिज्म हो गया? इन्फेक्शन हो गया, ठीक है. इन्फेक्शन नहीं भी होता, नॉन इन्फेक्शन रीजंस होते हैं जिसकी वजह से साइटोकाइंस फॉर्मेशन हो रहा है. साइटोकाइंस फॉर्मेशन वेयर दे आर टेकिंग प्लेस? They are taking place with the help of immune cells. What are the special immune cells which are responsible for their formation? They are especially the macrophage cells or the monocyte cells. Release of these special cytokines like interleukin 6, 3, okay, TNF, they are responsible for the formation or increased synthesis formation of prostaglandin E. What is the role of prostaglandin? To change the thermostat. आ जाओ दोनों, आगे आ जाओ, आगे आ जाओ, आ जाओ. खड़े हो जाओ, खड़े हो जाओ दोनों. So now, any more interested? Any more students interested to come and stand here? किसी और को शौक है तो वो भी आ जाए. When there is change, हाथ लगाने से क्या पता नहीं चलता? So these prostaglandins, they are responsible to change or to shift the thermostat. So now the body's normal body temperature will be 99 degree Fahrenheit, 100 degree Fahrenheit. तो अब जो थर्मोन्यूट्रल जोन है, लास्ट आदित्य, जो थर्मोन्यूट्रल जोन है हाइपोथैलेमस की, वो शिफ्ट हो गई है. अब वो 37 से किस पे पहुंच गई है? 39 पे, मे बी 40. अगर बॉडी सेंस कर रही है कि मेरा थर्मोन्यूट्रल जोन 40 पे आ गया या 39 पे आ गया, तो बॉडी विल आस्क विच सेंटर टू गेट एक्टिवेटेड? हीट जनरेटिंग सेंटर्स. कौन सा, एंटीरियर है या पोस्टीरियर है? एंटीरियर किसके लिए रिस्पॉन्सिबल होता है? हीट लॉस. और पोस्टीरियर हीट गेन. सो इट विल बी activating the posterior hypothalamus. It will be responsible for thermogenesis. Thermogenesis कितनी तरीके से हो सकता है? Shivering, non-shivering, behavioral. ठीक है. तो जब फीवर आता है तो क्या ऑब्जर्वेशन रहती है? बॉडी का टेम्परेचर बढ़ा है, आपका थर्मोस्टेट चेंज हो गया है, तो बॉडी के चेंजेस क्या होते हैं? शिवरिंग नहीं होती. शिवरिंग क्यों हो रही है? क्योंकि आपका जो सेट पॉइंट है वो चेंज हो गया है. नाउ द कोर बॉडी, द बॉडी इज एक्सपेक्टिंग टू बी मे बी 39, मे बी 40. सो इट इज गिविंग कमांड appropriately to generate heat. Okay, and that heat is getting generated by activation of posterior hypothalamus. So what the NSAID aspirant they do? They inhibit the formation of prostaglandins. So once you take paracetamol or NSAIDs or any medication, क्या होगा आपका वापस सेट पॉइंट चेंज होगा. चेंज होने के लिए anterior hypothalamus will be activated, and what are the changes you see? Sweating. Sweating is the most common phenomena that is seen to decrease the body temperature once the fever or the medication has been done against fever. So causes can be infectious, tissue destruction or unknown origin. When hypothalamus set point is reset at a higher temperature by pyrogens. Pathogenesis, endotoxins liberated by infecting agent and tissue destruction, act on monocytes, macrophage, Kupffer cells, release of cytokines, which cytokines, interleukins, act on anterior hypothalamus, increased production of prostaglandin E2, raises thermostat set point, and hypothalamus activates heat production and decreases heat loss. This is the pathogenesis of fever. What are the benefits of fever? It inhibits the growth of infecting agent because the body temperature has been increased, stimulation of antibody production, slowing down growth of some tumors. What are the harmful effects? Dehydration, negative nitrogen balance, and loss of sodium chloride. Why there is loss of sodium chloride? Because of sweating mechanism. Alkalosis, permanent damage to brain and kidney, persistent high temperature above 41 degree may lead to death at temperature above 43 degrees. So this is about fever. Other than fever, what are the conditions that are seen when there is increase in the environmental temperature? आ जाओ आप दोनों और आप दोनों आ जाओ, आ जाओ, हाँ आ जाओ, आ जाओ, आ जाओ तीनों, पीछे के तीनों और आप दोनों जाओ, आप भी जाओ, आ जाओ, मोबाइल दे दे, जाओ तीनों, आप भी प्लीज मूव, हाँ प्लीज स्पेशल इनवाइट, टेक योर मोबाइल. Heat illness falls under the category of hyperthermia. What is hyperthermia? Okay, hyperthermia is increase in the body temperature depending on the environmental condition as well. So when we talk of the environmental conditions, this heat illness can be categorized into heat cramp, syncope, exhaustion and stroke. What do you mean by heat cramp? It is intense prolonged exercise in the heat. ये कब हो रहा है cramp? Not during heat exercise. It is after the exercise the cramps take place. Okay. Tightening, cramps, involuntary spasm of active muscle, और इसका special feature जो कि इसको syncope से differentiate करता है, that is increase in the loss of sodium. Okay, so you get the question, differentiate between heat syncope, heat cramps, heat exhaustion. इन सब की ये टेबल आपकी आती है, ठीक है. हीट सिंकोप और हीट क्रैम्प्स में क्या फर्क है? हीट क्रैम्प्स जो हो रहा है आफ्टर द प्रोलॉन्ग्ड एक्सरसाइज इन द हॉट एनवायरमेंट. व्हाट इज द स्पेशल फीचर? अलोंग विद द डिहाइड्रेशन देयर इज लेस ऑफ द सोडियम आयन. व्हाट इज द टर्म यूज्ड व्हेन देयर इज डिक्रीज इन द सोडियम आयन? सो हाइपोनेट्रीमिया. ओके, व्हाट इज हीट सिंकोप? Peripheral vasodilation and pooling of venous blood. ये कब किस कंडीशन में हो रहा है? During exercise in hot environmental conditions. कब होगा? Acclimatized person में होगा या unacclimatized person में होगा, ठीक है, ये डिपेंड करता है. इसके अंदर दो इंपॉर्टेंट चीजें हैं, एक तो आपकी स्वेट मैकेनिज्म हो रहा है, स्वेट मैकेनिज्म से आपका क्या हो रहा है, ईसीएफ का वॉल्यूम कम हो रहा है। जब ईसीएफ का वॉल्यूम कम होता है तो आपका क्या हो रहा है, कार्डियक आउटपुट विल बी लेस। अलोंग विद दिस एक्सरसाइज के टाइम में आपका स्वेट मैकेनिज्म हो रहा है। स्वेट मैकेनिज्म किस वजह से हो रहा है, वेजोडाइलेशन भी हो रहा है। वेजोडाइलेशन हो रहा है तो पेरिफेरल रेजिस्टेंस क्या हो रहा है, डिक्रीज हो रहा है। पेरिफेरल रेजिस्टेंस किस प्रेशर से डायरेक्टली कनेक्टेड है, पेरिफेरल रेजिस्टेंस, it is directly connected with diastolic pressure. When there is decrease in the cardiac output, why decrease in the cardiac output, because of the decrease in the extracellular fluid volume. Along with the decrease in the cardiac output, there is decrease in the peripheral resistance. When there is decrease in the peripheral resistance, there will be decrease in the diastolic blood pressure. दोनों फैक्टर साथ में कर रहे हैं, so there will be decrease in the blood pressure. So during exercise the person will collapse. Heat syncope. तो इसके अंदर क्या लिखा हुआ है, peripheral vasodilation and pooling of venous blood. So decrease in the cardiac output, decrease in the cardiac output will result into decrease in the blood pressure, hypotension and hypohydration. But यहाँ पे कहीं पे भी सोडियम का कोई रोल नहीं आ रहा, but in case of heat camp there is special emphasis given to sodium. Heat exhaustion, cumulative negative water balance. Okay, only the person is taking water. Okay, and heat stroke, extreme hypothermia leads to thermoregulatory mechanism के failure को, that result into heat stroke. Acute medical emergency includes hyperpyrexia, okay, and lack of sweating. Okay, टेम्परेचर अपन ने देखा था कि अर्ली मॉर्निंग में कम था, 4 बजे अगर आप मॉनिटर करोगे तो मैक्सिमम होगा। इसी डायनल वेरिएशन को यूज करते हुए एक इम्पॉर्टेंट क्वेश्चन आता है, दैट इज ऑल्सो यू माइट हैव स्टडीड इन योर रिप्रोडक्टिव फीमेल रिप्रोडक्टिव सिस्टम, दैट इज नॉन इन्वेजिव मेथड फॉर ओव्यूलेशन. So exclusive short note comes on non-invasive method for ovulation. So from the day of ovulation the temperature slightly increases, but prior to ovulation the temperature is 0.6 degrees centigrade less in females compared to males, and at the day of ovulation the temperature automatically increases. So the maintenance of temperature is an important indicator for ovulation during the reproductive phase of females. What is hypothermia? Decrease in body temperature. What are the effects of hypothermia? Decreased metabolic activity, acid-base disturbance, electrolyte disturbance, blood abnormalities, coagulation is impaired, slowing of respiration and heart rate, lowering of blood pressure, slowing of reflexes, unconsciousness and even death. Hyperthermia is more dangerous or hypothermia? Hyperthermia or hypothermia, which is more dangerous? Hypothermia. क्यों? और चलो, extreme cold leads to number of vascular reactions. Lewis-Hunting reaction, vasoconstriction, vasodilation, vasoconstriction, vasodilation. So it is a sequence of events taking place. First there will be constriction, then dilation, constriction, dilation. So this particular term, Lewis-Hunting reaction, okay, that takes place. What is frostbite? It is the crystal formation taking place in the digits or the earlobes in the extreme lower external environmental conditions, okay, and with this formation of crystal, this is the frostbite takes place. लास्ट क्या इसकी सिग्निफिकेंस है, हाइपोथर्मिया कहाँ काम में आता है? इज इट बेनिफिशियल? यस, वेयर? सर्जरी. Okay, so this is beneficial also. Surgically induced hypothermia is used in brain and cardiac surgery. Okay, this is the normothermia, mild hypothermia, moderate, severe hypothermia, and these are the changes which are taking place. And heat acclimatization takes place within 10 to 14 days. You have already seen the adaptive changes. Thank you.